Have you ever heard the saying, sell them what they want, but give them what they need? If you're looking at building a larger referral base for your mobile physical therapy or occupational therapy business, I would encourage you to consider expanding your services beyond just Medicare covered services to non-medical companion care or caregiving services. So I'm looking here in the Cincinnati area. That's where I'm home based. And there are job postings on Indeed for non-medical companion care, ranging between $21 and $25 an hour. So if a business is paying this person $21 to $25 an hour, the business is probably charging $35 to $50 an hour. So imagine you're a brand new mobile practice owner, you're looking to build your caseload, but you have no connections with local physicians, you have no word of mouth network, you don't even know where to get started. What you could do is find this high demand, low capacity service, non-medical companion care, start to get the word out that you're able and willing to do this. Now, you would have to research local guidelines. You'd have to know your state and city ordinance to know what you're allowed to do and what you're not allowed to do. But as a licensed therapist, my assumption is most of you will be able to provide these services without any issues under your therapy license. Now, these are non-billable services to Medicare, but the beauty in this is people aren't always searching for physical therapists or occupational therapists. And when they are searching for those things, their doctor probably told them, go to the hospital-based PTOT service providers. So what you're doing is you're looking for those individuals that have aging parents that are working during the day. They're maybe professionals, they're working, they know mom or dad needs a little bit of help around the house. They don't want to leave them home alone for an 8 or 9 hour stretch. So they're looking for non-medical companion care services. They're checking Nextdoor, they're checking Angie's List, they're checking care.com. If you start getting the word out across those platforms, and many of those platforms will allow you to post for free. If you start getting the word out across local Facebook groups and maybe even writing articles with a little bit of SEO so that when somebody is searching for companion care in city state, your content will start to show up. Of course, I'm a huge fan of YouTube, so if you can start a YouTube channel and get some of that information out there, I can almost guarantee you will start getting interest. People will start contacting you. And so the important part here is you don't have to accept every client. There is a perfect sweet spot of a client that matches your goal. And so I would not take every client. Like for me, I don't do any neuro rehab. So if I was doing mobile therapy, I would only be looking for individuals that had orthopedic impairments, individuals that were appropriate for a physical therapy evaluation and plan of care. I would provide the companion services. I might limit it to a 2 or a 4 hour block of time. But with that, I would provide a fully compliant, billable Medicare physical therapy evaluation. If that patient is appropriate for medically necessary services, within the block of time, I would deliver the physical therapy visit while I'm there. So now if I'm coming to the patient's home 2 or 3 days a week, I'm providing a 4 hour block of time. That's kind of a long time for me, but I'm just going to use that as an example. 3 of those hours might be self-pay by the client or the client's family. 1 of those hours would be billable Medicare covered services. And then most importantly, what's happening is I'm starting to build a network. I'm starting to get some word of mouth. This patient's doctor sees my plan of care coming over for certification. This opens the door for me to reach out to that doctor, to possibly interview that doctor on my YouTube channel, to get referral pads into that doctor's office. I think this is a novel of enough approach that once people see what you can do, they will start to share the message. You know, if you want to be remarkable, do something that's worth remarking about. That's a Seth Godin quote. But the idea here is I get my foot in the door with something they want, the non-medical companion care, and then I deliver the things that they need, the Medicare covered physical therapy plan of care. And as my practice grows, as my word of mouth grows, either I have the option to hire somebody else to provide the non-medical companion services, or I could just stop taking on new clients that are non-medical companion care and PT, and only accept clients for the PT services. So this is just a stepping stone to the next level of your business, but I think it's a great opportunity, and I just don't hear enough mobile therapists providing this kind of service.